Florida, I have some interesting and exciting news for you. For people who suffer from heel pain, plantar fasciitis. What is it? Well, I have a lot of videos on that, but I'm going to explain it. This is the plantar fascia right here. This little band of, well, this is the muscle, but the plantar fascia is right about here. When people have heel pain in the morning, they have pain right about here where this plantar fascial band goes into the heel bone. This is the heel bone right here. Number 19 marked. So the plantar fascia goes into this heel bone. And why do people have pain and why do people have heel spurs? The pain is because the plantar fascia pulls on that bone and keeps on pulling on it. When it pulls on it, by a phenomenon called Wolff's Law, the bone forms more bone to go ahead and accommodate the pressure or the pull of that plantar fascia, causing a little bone spur down on the bottom. Now, how do we treat this? Typically, we do injection, physical therapy, strapping, using heel cups, over-the-counter inserts, or even custom inserts. 85% of our patients do better with that and physical therapy. But let's say for those who just don't get better, what do? Well, we have endoscopic surgery where we go ahead and take a little 4mm camera, go in, and we cut the band. The other way is a minimally invasive opening, but we still cut the band with the scissors. Small opening, we're able to cut the scissors, with scissors. The other option is the traditional. We open up the bottom, open it up, look at it, and we cut the band. So everything we do is cutting the band. Whether you do it by camera, you do it by opening, small incision, big incision, cutting the band. What does cutting the band do? It releases the pressure. So you form a little scar tissue there. It's going to fill in the gap. So you essentially elongate the plantar fascia, take the pressure off the plantar fascia, takes the pressure off the bone. Sometimes on MRI, we'll see swelling of the bone right about here, as well as swelling of the plantar fascia at the same time. So the bone is active, the bone is angry with you, and so is the plantar fascia. So you have soft tissue and bone that's angry with you. Now, back in the old days, before the MRIs, we used to think, oh, the heel spur must be the problem. We see it, it looks ugly, it looks like a little hook on the bottom of the foot, right? So we used to go ahead and take that out. But since the MRI, we found that not all the time is the bone inflamed, but or even the heel spur is inflamed. It's not inflamed. It's really the plantar fascia, the soft tissue, that's inflamed. Now we also have stem cell injections for that to help with the heel. We also have shockwave therapy, which is basically a big hammer device you put on the bottom of the heel after we numb you up. We use that for kidney stones. We use it for tennis elbow, etc. But plantar fasciitis is what's really good for people with resistant heel pain. We're talking about resistant heel pain. People that have done everything in the world conservatively and it doesn't work. That is where we step in. So for the 15% of you that have heel pain, despite all conservative care, we have the shockwave therapy. We have those surgeries I recommended. Recovery from the endoscopic could be 2 weeks off your feet and then walking in a boot for another 4 weeks. But exciting technology that I want to share with you today, and I have testimonials of 2 patients right after that have that are 2 weeks post-op, right after this video. Is that something called hydrosurgery. What is hydrosurgery? Hydrosurgery is using ultrasound as well as using water to differentiate, or saline to differentiate bad tissue and sucking out the bad tissue, selectively sucking out the bad tissue from the heel. So instead of cutting the plantar fascia, now we have technology with the use of ultrasound now to selectively cut the inflamed bad tissue. What happens when you have plantar fasciitis, inflammation, right? So inflammation, you're going to get inflammatory tissue. Inflammatory tissue has more water content. So we use this little probe right here, little probe, looks like a little pen, little needle. Water shoots out the end, and bad tissue or inflamed tissue gets sucked into this little hole right here. So it's a constant stream of water coming out and breaks up all the bad scar tissue, and it gets sucked in here. That's the layman's term how that works. So basically, this procedure, you're brought into the operating room. They give you a little anesthesia. We numb you up, make a small little poke incision, not even a big incision, a little poke. Everything's going toward minimal invasive now, a little poke. So under ultrasound, we put a little ultrasound probe down here. We can see the inflamed tissue. A lot of times we see that. We see the inflamed plantar fascia. We see normal here, and it gets hugely inflamed right here. So what do? Make a little stab. We go into this plantar fascia. With ultrasound guidance, we go in, out a few times with saline dripping as well as the vacuum going, and the vibration of the saline will break up some of that inflamed scar tissue, and then this tube right here will suck in all the debris, all the bad tissue that's been debrided. So what's left behind are good, viable, non-inflamed tissue, and you can heal. So basically, we're just poking the inflamed plantar fascia, breaking up the scar tissue, and then sucking it out with this vacuum right here. It's all done within this one device. So it's not much bigger than a blood drawing needle, an 18-gauge blood drawing needle, and you're under anesthesia anyway, and we're able to go in with a few pokes and go ahead and take care of this procedure without cutting the plantar fascia. This needle is going into the plantar fascia and just breaking up all the bad inflamed soft tissue, inflamed pathological tissue. So what are you left with is a steri strip and a little Band-Aid, and you're walking in a boot immediately. There's no time out. So that's why I'm very excited about this technology. There's no time off your feet with this. And it is covered by insurance, whereas PRP, we have that available. Stem cells, injection, as well as shockwave therapy, they're not covered by insurance. Well, this is covered by insurance for doing this hydrosurgery, minimally invasive hydrosurgery. Get you back on your feet quicker. It's covered by your insurance. We do it at a surgery center, at the comfort of the surgery center. You're walking on your feet immediately in the boots for about 2 weeks, and probably physical therapy for another 2 weeks. But patients have been very happy with this. These are people that we've had in a study at the center. We've weed out the worst of the worst conditions of heel pain, and even they are doing better. So we went through our database of patients. We asked them if they want to participate in the study procedure. The company allowed us to do a study on a couple patients, and they've done really well. And the testimonials right after this, guys. So after this, any questions or comments, please let us know. Put it in the comment section on YouTube. Talk to you then. This is Dr. Lam again. This is our second patient that we did the TENJET on at the Family Foot and Leg Center. So he had a lot of pain before that. As you saw with the first patient, the pain has decreased significantly. This is only 1 week. We used steri strips. We didn't use a suture on this one. And how's the pain after the procedure?
First couple of days was sore, but every day it's getting better and better and better. Yeah,
excellent.
Yeah, it feels great.
Excellent. So I'm moving the toe. I'm stretching it out. We did a good release over there with the TENJET unit. Any pain here?
No.
Any pain here?
Just right there a little bit.
A little bit, right?
Yep.
How does it feel, let's say, before the procedure till now?
Oh, yeah, it was tight. It would have flare-ups. It would hurt. Now with the procedure, I think it's just a little sore from the actual procedure. But,
Good.
Yeah, much better.
Awesome. We'll just do a follow-up in 1 month and go from there, my good man.
Okay, brother. Sounds good.
And this was done under ultrasound guidance, and the incision is right there. We debrided the plantar fascia utilizing the TENJET. So far, so good. Everyone's done well. Awesome. Great job. Well, this Dr. Lam is about 1 week after the TENJET procedure for the young man with chronic heel pain. He went through physical therapy, injections, and everything else. Am I correct?
Yes.
So this is about a week out now. This is his incision, and the incision is really a stab incision. He used to have a lot of pain right here. So, right here. Any pain today?
No.
We're a week out. He's been in the boot. So that's the incision. Chronic plantar fasciitis. Not everyone qualified for a procedure. We only do it for people who have failed conservative care. Basically, it's a little needle. We go in there, had ultrasound, uses the ultrasound to debride or cut out the bad inflamed tissue, versus using a knife. The other thing we're talking about is before this, we had a scope that we did. Using a scope, it's a 4mm scope we put in through the heel and we cut it. It's called the EPF, endoscopic plantar fasciectomy. But this is an ultrasound version, and uses fluid and sound waves to take away bad tissue. So far for him, he's 1 week out. He's doing really good. 1 stitch is all it took, but sometimes they don't even the company protocol not even require a stitch, but I like stitch. But they typically put just a little steri strip. So right now you can put a Band-Aid on for another week. I'll get you to physical therapy, get it stretched out, and get you back on your feet again. Sound fair?
Yep. I mean, I've been stretching it like just doing this. I don't know how that helps. But
that's very good. Keep with your stretching exercise. I don't feel that inflamed plantar fascia anymore because we see it on the ultrasound when we're debriding and cutting it out.
Are you going to check with the ultrasound or not? No?
Not today. We don't need it. When we did the procedure, the ultrasound was what guided the needle,
okay.
The ultrasound needle, to break up that scar tissue, break up the inflamed tissue. So I'm very happy with your progress.
Yeah, I am too.